with Indian Institute of Management, Sambalpur, Central University of Odisha, and Ravenshaw University, Cuttack. On behalf of Center for Adivasi Research and Development, I want to convey my heartfelt gratitude to our patrons, Professor Sanjay Kumar Naik, respected Vice Chancellor, Ravenshaw University, Professor Mahadev Joyswal, Director, Indian Institute of Management, Professor Sarat Kumar Palita, Vice Chancellor, Central University of Odisha. The convener of this largest virtual conference, eminent Indian historian, Professor Chandi Prasad Danda, an eminent policy activist, writer, and philanthropist, Mr. Charudat Panigrahiji. Ladies and gentlemen, the main outcome of this conference is to come up with the national and international framework for the education system in future. The crux of this conference will be the use of digital technology such as artificial intelligence, augmented reality, and virtual reality that is being increasingly adopted after the outbreak of COVID pandemic. We hope this conference would help students, faculties, researchers, and all to expand the mental horizon and help the education system to adopt the best in future. Dear friends, the Center for Adivasi Research and Development is a leading research-oriented institution promoting ethnographic, empirical, and evidence-based research on, for engaging and addressing the challenges that 21st century globe is facing today. Dear friends, the prime agenda of this institution is to come up with potential policy solutions for social change while believing in the idea of debate, dialogue, discussion, and with expertise, experiencing, and education. The institution focuses on marginalized communities and works for their livelihood to protect the nature, culture, language, and identity in particular ways. The age of modernity has witnessed that change is the only constant phenomenon for societal purpose to enhance knowledge. Our information work for them is methodical and avoid paradoxically framework which is neglected so many centuries from theory to become practice. The center sincerely believes the concept of social marketing, which is seriously looking for non-profit marketing and builds new social entrepreneurship for check and balance mechanism to glorify generations to come. Center for Adivasi Research and Development come to serve with the holistic approach of critical thinking in education, and for marginalized communities. It gives me tremendous contentment to introduce the most esteemed personality of today's symposia, is none other than Dr. Amar Jesani. Dr. Jesani is a medical doctor working as an independent consultant, researcher, and teacher in bioethics and public health in Mumbai, India. He is one of the founders of the Forum for Medical Ethics Society and its journal, Indian Journal of Medical Ethics. He is also the present editor. He is one of the founding trustees of the Anusandhan Trust, which manages the Health Research Institute Center for Inquiry into Health and Allied support for advocacy and training to health initiatives in Pune, India. Since 1979, Professor Jesani has been awarded and completed 20 research and training projects in public health and bioethics, and has co-authored and co-edited 8 books. The topic of today's discussion is policy ethics and rewriting the pandemic crisis in India, which will definitely be an eye-opening session for all of us. So without taking much time, I would like to invite Professor Jesani to initiate his talk. Over to you, Professor Jesani.
Okay, thank you very much. Let me share my screen.
Yes, please.
Are you able to see?
Yes, sir. Yes, sir. Please.
Okay. So what I'm going to talk about is, I've just refined the title of the talk. What I'm going to do is more of ethical reflections on the policies and laws to manage the outbreaks and pandemics in India, in the context of what kind of ethical guidelines or philosophical guidelines which are available internationally, and then look at what happened during the pandemics in India, and what are the legal and ethical aspects that we are missing in this crisis. And this will lead to some kind of suggestions about what could be done in future. As I was being introduced, you all came to know that I am editor of Indian Journal of Medical Ethics. This is the only journal on bioethics, medical ethics, healthcare ethics, and the humanities that is being published from India. It's a highly specialized journal. It started in 1993. We are in the 30th year of publication. And we also organize every 2 years National Bioethics Conference. We also hosted World Congress of Bioethics in 2018. So you can see that the ethics, medical ethics and healthcare ethics as a discipline, as well as a part of analysis in the public health, clinical medicine, and health research, have now become very regular and routine, which was not there when we started 30 years back. Even when I was a medical student, I was hardly taught any ethics. But today, medical councils recommend that the ethics, humanities, and communication, they must be part of the syllabus, and so they have started teaching them. So there is a small beginning, but I hope in coming time, there will be more people taking interest in it. So this is the overview of my presentation. As I was telling you, that we start with understanding public health profession and the practices, and how there is a centrality of ethics. The public health has a certain interesting ethical frameworks, internationally recognized, done by many scholars as well as public health association. So we'll look at different kind of ethics frameworks available, just as we have different ethics frameworks available for clinical practice. Same way we have for the public health professional practices. Then we come to the issue of human rights law and ethics that will provide you something at the international level, that what kind of international laws exist and international ethics guidance is existing in the subject. So we'll look at Siracusa principles of 1984, and then also look at WHO's, that is World Health Organization's ethics guidance of 2016. And then compare what happened in India. We also look at Epidemics Act of India and Disaster Management Act. Then the fourth one that I will take up is a related issue with the pandemic, is healthcare system preparedness. How do we use the scarce health resources? The hospital, the triaging, that is the rationing of the services, and what we need to do for making healthcare universally accessible. And then look at some global and local inequities in access to COVID vaccines, and then go into some conclusions. This is what I'm going to do, and I hope that will be sufficient to give you some idea about the basis of policies and laws that should inform the pandemic management in the country. Let us start with public health as a profession, and the centrality of ethics. As you know, when you say public, you are immediately, talking not about the individual, but we are talking about the collectives. As you go into the collectives or the communities or groups, you will find that just as there are power relationships within the individuals, you have also power relationship within the group. So you have a lot of hierarchies in the society: family, kinship, caste, religion, ethnicity, language, whatnot. I'm sure all of you know about it because your institution is working on tribal development. So there, all these issues actually come and converge. So all of them are very, very evident. And so when you are talking about public health, you cannot talk about public as a reform entity, but you have to look at different kind of people who exist. And particularly the majority of the people who come from the tribal groups, the lower caste groups, the poor people, and the people who are at the margin of the poverty and non-poverty. So these are the large number of people that we are talking about. We cannot design public health policies which are only for the people who are powerful and who have resources. And we need to actually assess all the policy decisions that we took in the last 2 years on COVID on this count, saying that were those decisions primarily keeping in mind the lowest of the lowest in the society, or they were more to protect the people who were more powerful. So this is a very, very important area in the public health and public health ethics. So ethics, apart from having all the philosophical consideration and all, is also a kind of a normative system which helps to create certain rules for the protection of the weakest people in the relationship. So ethics come into being, or it becomes very, very evident, just as human rights become evident when there is a relationship between people who are powerful and people who are weak. So medical ethics, we keep talking, but medical ethics is nothing but ultimately to provide protection to the patient. Or another word, the medical ethics is nothing but making people who are powerful in the medical profession or the doctors to respect the rights of the patients. So that is where we can talk. That is where the issue of medical ethics is located. In the research, normally the ethics are talked in terms of protecting the participants of the research, because the researcher can exploit the participant, more so in biomedical research, particularly in clinical trials where the drugs and vaccines and biologics are, or even in medical devices are tested. And ultimately, all those testing result into commodities which are life-saving, but which are also money-spinning for the companies which do research and which produce these drug devices. So in research ethics, that becomes the most important part, how to protect the participant. And the scientific practice ethics, that is about integrity. Anybody wanted to say something?
No, sir, please continue.
Okay, fine. So when we come to the public health ethics, then what is the major objective of the public health ethics? It is to provide protection to people, groups, and individuals from excesses of the public authorities of the state. As you can see that most of the public health interventions are led by the state government. So public health authority means the government authority. And if they take certain decisions in their intervention in the public health, then we have to see that individuals and the groups of the people are protected from the excesses, that they cannot misuse the power. That is very, very important. So public health practices centered on collectives, communities, and population. By its very nature of work, public health may be required to take measures that may adversely affect and or not to be liked or opposed by some individuals or the groups. So it is a issue, public health deals with the collective and the groups, but at the same time, it cannot ignore the individuals within the group. So individualism and the collectivism are not juxtaposed, but they are considered to be complementary to each other. That when we talk about the larger groups, we should not forget about the individuals also. And when we talk about the groups, we should not forget about the smaller groups within the group. That means the minority, who may not agree with what intervention is being carried out. And we have to ensure that they are not exploited or they are not stigmatized and targeted. That is very, very important. It is not majoritarianism. It is about improving the health of the larger community, and in the process, there may be people who may require more protection as compared to the others. That means the intervention of the public health has to be justice-based and equity-based. That is very, very important area. That is why I've said in this next slide, that justice is, to my understanding, a cornerstone of public health ethics. If we forget justice and the equity, then we may become more like a dictator in pushing our own idea of the public health on the people. Those ideas may be scientifically good, but yet it may become highly oppressive for the community. So what we have to do is that if we are respecting the community, then we'll educate and we'll try to make them understand what needs to be done. And if anybody is affected in the process, then we should take care of them. So that is what will come as we look at the frameworks. So questions of justice arise when there is a concern regarding the fair apportioning of the benefits and burdens of the intervention. Very important. When you say lockdown, but when you lock down, who is getting benefits of that lockdown and who are people who are burdened? Like people like, say, middle class people like me in, say, Mumbai city. When the lockdown started, we had no problem. We had our own mobiles, we had our own resources. We call up and the people will deliver food, they will deliver ration at home. But there were people who were just delivering. They were going around in the road as essential workers. They were exposed to the risk. On the other hand, there were half of Mumbai's population live in poor localities called slums. They don't have even house where they can have social distancing or physical distancing. Forget about having money, because you are earning daily and surviving. How do they get food? How do they really keep themselves infection-free there? So when we announce lockdown scientifically, you say, oh, that is right. But the science in the context, when you see it, you find that it is creating burden for certain people. So what do you do there? I think that is where the public health ethics comes up. And that is where any policy, any law that we frame must take care of. So we have to know that what people deserve or what they are entitled to have. Not only the powerful people, but even less powerful people. That is where the ethical consideration comes. Equity is a very important issue. You cannot treat everybody equal because people are not equal within the group. There are different groups. Some groups are powerful, some groups are less powerful. So it is very important that you treat alike like alike, but those who are unlike or unalike, they must be treated differently. So those who are having less resources, they cannot be left on their own. You have to provide them resources to survive. While the people who already have resources, you don't have to give them resources. So what you are doing is that, that your intervention has a two different quality. Some people require certain kind of intervention, some require another kind of intervention. So you have to keep it in mind what is called compensatory justice. So you may have affirmative action that you provide more support for instance, like say in Mumbai, when the pandemic started, there was a major concern that what will happen in Dhara, one of the largest slum population in Asia. Now, they thought that the infection will spread so high there, so much that there will be devastation. Now, your lockdown has no effect there because people have no place to go, so there were no choice but to sit outside their huts. They have no food. You have to provide something to them. If they get infection, if it's a mild infection in my house, we'll keep the person in a separate bedroom and observe and keep that person in isolation. But they have no such room. Then in one room, there may be 6 or 8 people living in that hut. What do you do? And that's where they had to make intervention and create a community-based COVID care center with a good community participation. And at the end of first 6 months, the Dharavi became a kind of a model how to actually implement it. Now that implementation was very, very different from the implementation that was done in the middle class locality. So that itself says that you cannot just have one standard to treat everybody in the same way. You have to have a different standard depending upon what is the condition of the people. So there is an issue of compensatory justice. There is the issue of distributive justice. Both of them are very, very important when we talk about the philosophical or ethical basis of the policies and laws. Now let me take you through more of an academic, but it definitely provides you a background. There are at least 4 different ethics frameworks with a lot of overlapping things in there. Most of the things are very common among them. So it's very important to understand that how 20 years back, when public health ethics as a discipline became very popular, and there was a lot of work done with the groups of individuals coming together and designing the ethics standards for public health. And so this frameworks came into vogue at that time, and they are very, very popular. So you should know about it. This framework was developed by Nancy Cass. This was more based on public health programs. Like say, if your card, in CARD, you are having work with the tribal people, and there you develop the public health program. So how the public health program that you develop will become ethically justifiable or ethically right? So in order to understand that, what she says is that you need to have an understanding of what are the public health goals of the proposed program. What do you want to achieve? Are you just trying to achieve some maternal mortality? You want to bring it down, right? How effective is the program? So if you have say that this is the problem, then your intervention must be scientifically correct. So is your intervention is right? The intensity of the intervention is proportionate to the requirement of the condition that you are trying to change. You are not overreacting. You are not trying to push people, but you are trying to gradually change them in a right way. Is this program going to create burden among some people in the community? Who are those people? How much they will be burdened? Can this burden be minimized? This is the 4th principle that she talked about. If burden cannot be minimized, are there alternative ways of doing the same program so that people are not burdened? Is it implemented fairly? Or is making some people do more, or it is harmful to certain people? So the benefits and the burden of the program must be fairly balanced among the group. And at the same time, it should be scientifically valid and should be able to, would lead to the desired goal. So this is the first ethics framework that came up here, long back, 20 years back, 2001. This was Childress. You know, this Childress, James Childress is a well-known person, and he is one of the fellows who was involved in designing what is called principalism. The 4 principles of bias is well known. He and others elaborated it. So he also went into this, and he came out with the 5 considerations, which are very much like what Nancy Cass has said. So effectiveness, that your program should be effective. As I said, that means scientifically correct, and it should be workable in the context where you are doing it. Proportionality is very important, that your intervention is proportionate to the requirement. You are not overreacting. It is necessary. That means people consider it necessary to have it. That means taking people on board. It infringes the community and the individual's liberty the least, and it takes people on board by having a public justification or engagement. You know, so community participation is very, very important. So these are the 5 principles that he came out with. American Public Health Association in 2000 developed a 12-point framework, which is very, very important. You know, but it is a broader one. It is not just for the program and issues related to the pandemic. What it says is that the public health must address principally the fundamental causes of disease. That means they should look at the determinants of health, which are causing disease, you know, and they should concentrate a lot on the prevention of adverse health outcomes. As all of you know, that public health has those 2 major qualities as compared to the clinical medicine, which is more for curing the diseases which have taken place. Here you try to look at the causes of the disease. What causes it? You know, there may be socio-economic causes, there may be biological causes, but these are the causes which are addressed by the public health, and by addressing them, it helps to prevent. It has also, public health also has a smaller biological component, like say vaccine and all. You use medical devices to actually prevent disease. The second point is very, very important. That public health should achieve community health in a way that respects the rights of the individuals in the community. Infringement of the individual rights should be minimal. That means proportionality is very much important. But if you infringe that, it must be as minimum as possible. The public health policies, programs, and priorities should be developed and evaluated through the processes that ensure an opportunity for inputs from the community members. There has to be public debate and discussion before you actually make the intervention. That means taking people on board. I think that was very, very important. And unfortunately, what we saw during the pandemic time was that, there was no interaction with the public to bring them, to take them on board. Public health should advocate for or work for the empowerment of disenfranchised community members, ensuring that the basic resources and conditions necessary for the health are accessible to all the people in the community. That means, again, this what I said earlier is that those who are the least powerful, they must be looked after. And if your intervention is going to affect them more, then they must be compensated for it. So you have a reciprocal responsibility towards them. Public health should seek the information needed to implement the effective policies and programs that protect and promote health. That means you have to collect the right kind of information in order to scientifically design your program. Public health institutions should provide communities with the information they have. Now, this is nothing but what we call transparency. When you implement a public health program, how much information are you providing to the public? This is very important. We can't be extremely paternalistic there and say that, well, if we give the information, people will start, opposing it. This is what happens during vaccine. Even people who support vaccination, if they raise scientific issues, the censorship used against them. When we say that, well, why haven't you, say, made data of the clinical trial of the vaccine available in the public domain for everybody to have a look at them? They said, well, by raising this issue, you are actually creating hesitancy. So here it is very, very clear, requirement that if you are designing policies and the laws, please ensure that there is a transparency requirement, not just for vaccine, but for all the programs that we may implement in order to control the pandemic or the outbreaks. Public health institutions should act in timely manner, that means it should be at the right time. Public health programs and policies should incorporate a variety of approaches to anticipate and respect diversity within the community. You must keep it in mind that certain people, as I was saying, require more inputs as others, because they are not equal. Everybody is not equal in this society. So you cannot have a program which is uniform. There are people who may require more support as compared to the others. There may be people with certain kind of beliefs which require more persuasion and education as compared to the other people. So we have to keep that in mind. Without that, if you say that the one approach is all right for everybody, then things may not work, and that may lead to people not participating in the program in a voluntary manner, or they may rebel, or they may neglect to participate, and the effect of the program may not be as desired. Public health programs and policies should be implemented in a manner that are to enhance physical and social environment. Environmental issues should be kept in mind. Public health institutions should protect the confidentiality of information. Very, very important. Oftentimes, the public health authorities make names of the people explicit and violate the confidentiality. And that has led many people to hide disease simply because they don't want to get, say, stigmatized. They don't want to be persecuted by the authorities. So you must keep it in mind that confidentiality of private information is very important. When you make an exception that yes, there may be some amount of information may be given out, then you must explain in a proper manner, and you must ensure that because of the disclosure of the information, if a person is harmed, then there is a protection of against the harm. If there is a potentiality of a person getting harmed because of the name being taken in the public, then you must see that the person is protected from the reaction of the other community members. Public health institutions should ensure that there is a professional competence for their employees. Training of the public health professionals and others is very, very important. Public health institutions and their employees should engage in collaborations and affiliation in ways that build the public trust and the institution's effectiveness. This is said many, many times that at the end of the day, if public trusts the public health institution, then the programs will succeed. If they don't trust you, even the best program will fail because people may not participate. People may say that, yes, okay, you can do it, but in reality, in practice, they may try to avoid it. And they may not report diseases, that those kind of reporting from the community may be required and all. So this effectiveness comes from the winning the trust of the community. This is the last framework that I'll talk about. This is the best one that I know of. It is based on 4 major principles, very important. It talks about harm principle, that your intervention can it limit liberty? Can it say people to take away some of their fundamental rights? Let's say lockdown took away your fundamental rights to move around. Okay. Now, should it be done? Here is a J.S. Mill is quoted by him. It is by Ross Upshaw. The only purpose for which power can be rightfully exercised over any member of the civilized community against his will is to prevent harm to others. That means you can exercise certain power to limit the liberty, but you must justify it in terms of the prevention of harm. Second is that if that is how your intervention is going to be, then your intervention must be least restrictive. Have used force only to the extent that is required. That proportionality is very, very important. If an education intervention can lead to people people becoming disciplined and not doing certain things as required, then you don't require force. So it is very important that education, facilitations and discussions, all kind of interdictions, regulations, and all kind of things that we are using are part of our approach, so that so that the intervention that we have to restrict people is proportionate to the requirement and not very harsh or repressive. And in doing so, there should not be discrimination on the caste basis, religion basis, which is very important. And you know that during the pandemic in India, there were a lot of discrimination carried out, and the minorities were stigmatized. The third is reciprocity principle. If you say that I am going to restrict you, I will not allow you to work because there is a lockdown. But then how do I survive? So somebody has to give me ration. Somebody has to give me fuel so that I can cook and eat, isn't it? That means it is reciprocity. When you restrict, you must reciprocate so that the person can survive in a human manner. Now, this was not done, and it is not doing because the whole thing was done at a massive scale, national level lockdown, which was the madness, to my understanding. Lockdown normally are done in a very focused manner, as per the requirement. China is doing massive lockdown. Again, I find it madness. Right? You cannot overreact. Its proportionality needs to be kept in mind. And you also need to keep it in mind that you have a reciprocatory obligation, ethical obligation, to help out people who just cannot survive when you restrict their movement and their work and employment. And the last is transparency principle. Very, very important. What you are doing, everything needs to be transparent, and there has to be due process so that people can appeal against misdeeds of the official. What it says is that all legitimate stakeholders should be involved in the decision-making process, have equal inputs into the deliberation, and the manner in which decision-making is made should be as clear and accountable as possible. That is what is required in the transparency. Now let me go into the laws and international laws and Indian law. These are the two very important ones. Siracusa principle came from the International Commission of Jurists, and then there is a WHO, World Health Organization's ethic guidance. These are the 8 major issues that I have culled out from these two documents. Again, they may repeat the earlier framework, but they are very, very important. Again, it says that what intervention you design must have scientific basis. It should be less restrictive, as we had talked earlier. You must take into consideration the cost and logistics. You go for a huge intervention and then you don't have means to actually effectively do it, then it is no use. You dilute it. And at the end, it is not actually producing the outcomes that are required. So you must take all this into consideration You must ensure that there is a human condition. You have lockdown, give people something to eat, survive, entertainment, and all kind of stuff that is required there. If you put person in quarantine and isolation, the places where they are put there, they must be having a good standard of living. If that is not there, then you are creating very inhuman way. It's like putting them in prison. People should feel like sitting in the quarantine as a part of their social obligation. And they should realize that when they are in isolation and quarantine, they're treated in a human manner. There is empathy towards them. You cannot consider people who are infected as a people who have done something wrong. You cannot blame the victim. Victim blaming is a major problem when we become inhuman in treating them during this kind of times. Addressing financial and social economic consequences. That is what is called reciprocity. That they must be addressed. If you are not creating a plan for it, but you are only creating a plan to impose restriction, then it is done in a very inhuman way. It is not a health way. Health intervention never begins with the harming of the people. Even if the health intervention is going to has a potential of harming, it will keep a plan ready to minimize it and balance it by giving benefit. So that is what is required here to understand the socio-economic consequences, and the plan should be there. You can't just keep your police ready to enforce ban, but you don't have your system ready to take care of people who is going to suffer because of the ban. Due process protection. The people who are imposing restriction, they can do things wrong. They can do it in a biased manner. They can use excessive force. During lockdown, we saw a lot of police excesses. Now, that is very, very important. That there should be due process. People who suffer, there has to be a good place. So you have to have magistrate all over. They are there. Only thing we have to use them during this time and tell them that this is your special work and you have to give judgments immediately so that people who are having grievance, they are taken care of immediately. And if you do that, then people will accept the program which is restricting their rights. There should be equitable application, as we talked about. That it is issue of equity. It's not about uniformity. It is by taking care of those who are weaker in a much greater way than as compared to those who are having resources. Communication is very important. Providing them information is very, very important there. Let us take Epidemic Diseases Act 1897. That was the one which was used in a massive way by the central government during this time. Is this law having the ingredients of the kind that we talked so far? I think that's very important. It's one of the shortest
Because of some technical glitch, Professor Jesani will disconnected. He will join soon. Please be with us.
Well, I'm so sorry.
Sorry for the interruption.
But
Professor Jesani is now joined.
it took time. Well, I took time to get my hotspot on because suddenly my cable connection snapped.
Please, sir, please start.
Yeah, what I was talking about the law that we have, that is called Epidemic Disease Act, and I was saying that in the late 19th century, when there was a big epidemic of bubonic plague in Bombay presidency, that was the time when it was enacted in order to help the colonial government to control the population. People were dying like anything, and people were running away from the city. And at that time, the government wanted to enter their houses. They wanted to do all hygienic things without, looking for the people's support. And of course, people were very, very hostile to the colonial government. There was no trust. I think it is very important that the public health authority has trust. When they don't have trust, they have to use power. So that's how this act was at that time, passed, and it was one of the shortest act in India. It's only 4 sections. The first section talks about the title and the extent, and the second section gives the power to the central and state governments to take whatever special measures they consider appropriate to contain the spread of any disease, which is a contagious disease. Section 3 gives the penalty for those who are violating those regulations done by the local authority. And the fourth is those who are implementing it. They are protected, not the other people. And in 2020, during the COVID epidemic, they also did amendment in it in order to protect the doctors and other health workers against violence. So here, it is there are a lot of problems there. There is no good definition of the dangerous epidemic disease, where the very draconian measures of the Epidemic Disease Act can be used. There is in it disease notification requirement. That means issue related to confidentiality are there. And there are also other issues where disclosing name of the people who are affected, as well as there are also positive measures. So the whole law that we have, it's epidemic more like a law and order problem rather than a public health problem. Normally I don't like use of police in order to implement the public health measures. A good public health measures with the trust of the people can be implemented more by the public health workers. You have a huge army of public health workers, starting from sanitation workers to the health, workers to the nurses to the doctors. It should be much better. It doesn't provide any description of duty. It only says that government has to implement this, do regulation and do this. Job is like law and order, go and discipline people. It doesn't say what are the duties of the government. That's it. You are seeing information. You must see what are the adverse and you have it would have been very easy. If you put it down, then you must also fight people who are affected by it. I know. So it is not a law and order problem. It's about health issues. So there is no focus there on ethics. There is no focus on how to balance restriction with the reciprocity of the government. You must have read about the Supreme Court order on providing 50,000 rupees compensation to the family of the people who died during COVID. But that didn't come from this law. It came from another law that is called Disaster Management Act of 2005. So the Epidemic Disease Act is a very, very weak law in India, and we have to redesign it and taking care of what I was talking earlier. So from our experience in COVID, there are certain things that we need to take care of if we are when we are implementing law like this. Should be no discrimination problem. actually because of system and all, discrimination is very much part of our normal life. So that's where we have to guard that. Professional work. You have to keep in mind that who exists of restriction on liberty and why. Why are people who are laboring people, their liberty is restricted the most? So much so that there is support to them. And they may have to walk back to their native place, hundreds and thousands of kilometers. This is a very important issue. Because liberty is restricted. All of us know that during COVID time, the rich became double rich. So private hospitals, the private sector, or the corporates, the profits were not restricted. Their work was not restricted. Why couldn't government tell this thing that people are allowed to come out on the road? Like in houses, big together. The governor of the hospitals have to go to the one of the government or public order. So sorry. I don't know why it happened, but I think it happened because my cable connection came back. So,
no worries, sir. Please continue. Everywhere the same problem, internet problem.
In my house from morning till evening, all the lectures we deliver online. So
here is also the same problem. So
continuously on.
Yeah.
Anyway. So it's very important that we keep it in mind that when we put restriction, whom we are restricting, on whom we are creating, on whom we are allowing them to escape. And as I said, the reciprocal compensation should also be part of this implementation process. The most important part is that nobody should be stigmatized and scapegoated, as it happened during pandemic. Now, the other third part, and that is the final part, is there is a very important issue of the healthcare system preparedness. And we have to see that, as I was saying, that when you have a health system which is based on the market, then it grows only in those areas which are rich. You are organizing it from Orissa, and you know how weak is the health system there, as compared to say Maharashtra or Punjab or Haryana, rich states. Rich states have a massive private healthcare system, not public health system, except Tamil Nadu. Tamil Nadu has a very strong public health system, a totally different tradition. But in Maharashtra, there is no strong public health system. Gujarat doesn't have strong public health system. So simply because there are more people to pay, they continue having a system which is more controlled by the private sector. So very little allocation is made. We were just looking as a part of Jan Swasthya Abhiyan. We're looking at the government of Maharashtra's budget, health budget, the latest which came out recently. And it shows that during pandemic time, they increased the budget. And as soon as the pandemic is win, you suddenly find that we are back to square one. So instead of, improving the health system so in such a manner so that in future, whenever there is a pandemic, it can be taken care of, we have gone down. Right? The public sector, which is used by the poor, is starved of fund, human resources. Even the doctors who were recruited during the pandemic time in the public system, they are allowed to go because they were all recruited on a contract basis, not as permanent doctors. There were massive vacancies, but they were not actually filled up. They were just brought on contract basis, and now they say that get off because we have no money. So such a public system gets overwhelmed in a very easy manner, and that is what had happened in Mumbai city in the beginning. The ravages of pandemic, some increase in financial allocation, but the recruitment of the permanent health professionals, improvement in public health infrastructure has not taken place as was expected. One can say that, well, when such a massive pandemic which threatened the humanity would have made the rulers of this country very wise and ensured that at least in the field of health, they will not allow unnecessary profiteering and there will be more equity created. But that has not happened. Even providing reciprocal priority care to the health workers who got infected was not followed during the time of the pandemic. The other is rationing the resources. How do you do it in a manner that maximizes benefit? How do we ensure that the people who are politically powerful or important people do not corner the scarce resources like intensive care beds and that kind of stuff? I think those things we don't have. We still don't have a good triage and rationing requirement that how the resources will be used when there are large number of cases as it happens during pandemic time. And there should be in place guidelines which are legally enforceable so that there is the people who suffer during the pandemic time, they are taken care of. This is about global inequity. We were talking earlier about the inequities in the Indian setting. This is about global and it is related to the vaccine. All of you know that certain parts of the world, particularly Africa, as you can see, is the list covered by the vaccine. India is in the middle. There are rich countries which have many rounds of vaccination as compared to the poor countries. So there is a large number of countries, 52 countries that the least wealthy. They had only 4.6% of vaccination as compared to many other countries, rich countries, which had, as I said, multiple rounds of vaccination. So this inequity is not just about national inequities, but also about the international inequity. Let me do the concluding remark is that one thing that we must learn from this crisis is that we must build universal access healthcare service. And that should be available irrespective of people's capacity to pay. This is not a new concept. 1946, just before the independence, there was a Bore committee report which talked about providing healthcare to everybody irrespective of one's ability to pay. I think that is one that we must learn. The next pandemic, if it comes out to be more severe than this one had a low mortality rate. But if another pandemic comes where the mortality rate is higher than the COVID was having, then you may require much better functional services. It's not going to be sufficient to have privatized services. They will never respond to the crisis unless they are paid. While the public services are the ones which actually go and stand by the people. And that I think we require. That is very, very important. Healthcare system and the state's response to any crisis ought to be informed by the evidence-based policy. Science is very important, and without science, if you design intervention, then they are going to flop and they are going to cause more hardship for the people. It requires good financial support, public financial support. The social, economic, and political determinants must be addressed. The nutrition, food security, water and sanitation, environment. No political and business interference in the science and so on. These are the issues that must be taken care of. And as I said earlier in the previous thing, is that we must have a policy and law which take into account the fundamental ethical principles that I was talking about as a part of the frameworks of the ethics for the pandemic and the public health. They must be taken care of. If they are not there, then the law like Epidemic Disease Act would remain very inadequate in responding to the pandemic like this. I'll finish here and wait for any questions or comments that you have, and then you can have some discussion.
Thank you, sir, for wonderful insights on the topic. That you rightly mentioned that the COVID pandemic has undoubtedly altered the routine of our life and caused unanticipated changes, resulting in the severe psychological responses and mental health crisis. The study aimed to identify psychosocial factors that predicted distress among Indian population during the spread of this pandemic. You are right to mention that people affected by humanitarian crisis and those living in low settings are differently impacted by the COVID outbreak. And these settings, critical measures for COVID-19 prevention and control that have been features of the responses in higher resources setting may be more difficult to implement, and some of them are potentially harmful to the survival of many community members in addition capacity for testing, isolating, and treating those who develop the disease. Tracing and quarantining contacts may be severely lacking locally, owing to weaker health system. Public health and social measures in these settings need to be balanced against our risk affecting their communities. Sir, I have gone through your articles in 2020 that you were talking about. The name of the article is Scientific Integrity Tested by COVID-19 Pandemic. And you were rightly said about that a particular journal called the New England Journal of Medicine and Nature denounced. In the editorial, they talk about that the United Nations politicians, the journals talk about the issues, political issues, and why the Indian journals or any research organization do not raise questions on the political issues or talk about the changes in political atmospheres and all that you have written in this article. Please throw light on this, sir.
Well, this is editorial of the Indian
Yeah,
Journal
yeah,
of Medical Ethics that you're
yeah, yeah.
mentioning. Now, when I said it because the public health is highly political. As I said, the public health is normally implementation takes place through the state agencies. So when you say public health authority, that is normally, it is the government authority or or the authority which is not part of the private sector. So now when you are talking about the public health intervention, it just cannot remain without politics, simply because it is public, part of the government. So there is a well-known, adage which comes from the founding of the epidemiology. There was a fellow called Rudolf Virchow. Rudolf Virchow was a Prussian epidemiologist who did studies initially in mid-19th century to show that in order to control diseases, we should look at the prevalence and occurrence of diseases. So he founded the discipline of epidemiology. He said that medicine is social sciences. That's what he said. Medicine is social sciences, and politics is medicine on the ground scale. So if you want to really do a great public health intervention, then it can be carried out by having a right kind of politics. If your politics is biased, if your politics is in favor of few and not in favor of the large number of people, then the way you implement public health is going to be biased. It's going to be less sensitive to the larger masses of the people. So there is a need to balance or synchronize the public health intervention and the ideology of the state. If that do not go together, then it is a problem. And the last point I would say is that I was criticizing Indian journals. Oh. Can you mute yourself? Because there is a lot of noise coming. You'll have to mute, yeah. The last point I was saying is that if you read medical journals in India, they normally don't make any political comment. For instance, in Indian Journal of Medical Ethics, we published a paper which was about how the police repression in Kashmir, about using the pellet guns. Pellet guns are the guns where it emits small pellets which penetrates the body all over. So these are small pellets, and then those pellets were causing large number of blindness among the people who were protesting. So we said that this is a public health issue. This is not just about law and order issue. One has to again talk about the proportionality. That when police uses a pellet gun, is it really using it in a proportional manner in order to control the crowd? Police has a right to control the crowd, right to control violence by the groups of the people. But when they use force, they must use force in a proportionate manner. They can't use it in disproportionate manner. And we publish a paper by a well-known public health expert saying that all these studies show that this kind of crowd can be controlled in a different manner. And using pellet gun is no longer accepted as ethically justified in most of the situation all over the world. Only it is being used in a country like India, And immediately we received a lot of protest letters saying that how can you do that? This is an issue of security, national interest, and all kind of stuff. And but interestingly, the British Medical Association's people, the people who are in charge of medical ethics in British Medical Association, they wrote an article in response to this article, saying that, defending what it was being said. He said that, well, this is a right of the journal to publish this kind of article because it has a aspect of the public health ethics in it. And that's how the ethics journal can publish it. That's how the medical journals can publish it. Can you imagine, the New England Journal of Medicine and the Lancet publishing papers to show that when America attacked Iraq and Saddam Hussein was overthrown, the number of mortality that took place, ran into hundreds of thousands, millions rather. And they did the calculation of how many people were killed by the American intervention. And that number is much, much higher than what is happening in Ukraine, okay? And they published those studies. They are systematically done studies published in American and British journal. And nobody ever raised issue because those studies have a real political aspect. But somehow or others, in India, the medical journals are becoming more technical rather than having, some kind of commitment to the ethics. The term profession, when you say medical profession, term profession includes what is called profess. Profess means making commitment, right? So there cannot be a profession without an ethical commitment. And so if you are your journal for the medical profession, then it must have ethical, commitment. Otherwise, doctors will not remain doctors; they will become technicians. So that's why I use in that editorial this example that why Indian medical journals are shying away from talking about politics and say that the kind of measures that were taken during the pandemic were determined more by the partisan politics than the scientific politics as we require during the pandemic time. So that is what actually would be the right kind of public health intervention. But they did not do it. Even when that episode in Delhi where Muslim clerics had come together and the Markan that all the from international and there was a big stigmatization and against them. The medical journals never came out saying that this is wrong. This is not the way to do, But that's how Indian science is at the moment, highly sanitized. And if that remains like that, then it will not be able to have a kind of public health commitment as it is required.
Thank you, sir, for your insights. So there is a question from Facebook. Someone asking that how do you explain the critical infrastructural resilience and what of strategic crisis management in medical?
Your voice is gone. Is it my system is unstable or your system is unstable?
So also,
I'm not able to hear anything. Can you hear me?
Yes, sir.
But I'm not able to hear you. You are saying medical infrastructure is inadequate, or what is it?
Rudra, please. Hello.
I not
Rudra?
hear.
Yeah. Sir is not properly hearing your question. Please write it down in chat box. Thank you so much, sir, for your wonderful deliberation. I would like to know a few things sudden when you are talked about the holistic approach of particular ethics as concerned in terms of objectivity related to medical health practices of India. And I know, I knew you from more than a decade and than ever when you were joined in an international conclave in Ravenshaw University. And you are talking so nicely in that particular time. I would like to know and give you some example. One is Satyamev Jayanti's this American episode where he invited the doctors and talking about these medical ethics or the practice as well in numbers of villages. I know you, Sakhi and Anant sir, all collaborating, working together for highlighting these medical ethics as concerned. And second, if you look the Rajnikant's movie, Shivaji, The Boss, where that movie taught us in terms of this Indian ethics as concerned related to public health policies, how far is concerned and where we are today in post-pandemic life world. No doubt you were talking so nicely about your 55 minutes of lecture related to highlight so many aspects of Indian medical science, and you rightly mentioned medicine is a social science subject and everybody should take it, get through properly, and how psychology is very important in these days in terms of stress management, and social psychology is concerned in terms of individual perspective. And sir, I would like to know how these particular pandemic, post-pandemic life world, people are so nicely talking about the new normal life. What is your observation? What is your assumptions? And what is your sense of understanding how to look at the India, the 140 billion people are working together and living together in terms of vibrancy, weak public health policy in India? Please, sir, need your answer.
Well, I think I already stated some points on this. I think when Rudra Narayan was talking about medical infrastructure or hospital infrastructure or health infrastructure, the thing is that it is very unevenly developed in India. And one of the major reasons is that we are not putting public money enough to create a strong public health system. We are leaving the entire thing to the market. So we have a large number of doctors, but they are concentrated in those localities where there is a purchasing power. So if there is no purchasing power, you will find that the private system doesn't develop much. So what we have to do in a country like India is that we have to have more focus on developing public health system. Government has to put money there and to really build it from below, starting from the sub-center to the primary health center, not at one primary health center for 40, 50,000 people. You have to have a primary health center with 30 beds in 20 or 30,000 people. That was what Boer Committee report in 1946 had recommended. So that kind of building, and then having a first level referral and district tertiary care center. These are all required. The primary health inputs and investment is most important, and that must be supported by the first, secondary and tertiary care support is the most important thing that we can do in the post-pandemic era. If we have learned some lessons, then that is the one. That during pandemic, why people died so much in the first wave as well as in the second wave. Third wave was mild because it's Omicron, not having that kind of mortality. But in first and second wave, you have seen the pictures. You have seen the clips of how people have suffered. Now you can't have go to the square one, as if nothing has happened in last 2 years and do nothing about it. In order to recollect correct the way infrastructure has developed. Infrastructure has developed better in rich areas as compared to the poor areas, in rural areas and tribal areas and hilly areas. I think that is where we need to do our job. So I think that is a major learning for me from this. And we have to build what Europeans and Americans Canadians have done, universal access health system. Even the countries like Thailand and Sri Lanka and others have done it, which India has so far not succeeded in achieving. So that is what I would say, that this should be the learning from this pandemic.
Thank you, sir. Thank you so much. And sir, when we are
if you have any question, you can send me by email, and
okay,
I will
sir,
definitely answer them. Yeah.
Thank you so much, sir. And now I'd like to invite Rudra to go for a formal vote of thanks. Thank you so much, sir, for your valuable times and such a wonderful lecture given by you on the aspects of this pandemic and crisis of medical ethics. Thank you so much, sir.
Welcome.
Rudra, please go for formal vote.
I think his internet connection is having a problem.
Yeah.
Like mine.
Thank you, Dr. Jaina. Yes, sir. Thank you so much, Dr. Jaina, for your insights. First of all, let me thank Dr. Amar Jesani ji for their wonderful talk and their contribution and time. I have to acknowledge the institutional contribution in terms, especially in particular, Indian Institute of Management, Sambalpur, Central University of Odisha, and Ravenshaw University. A special thanks to our patrons, Professor Sanjay Nayak, Professor Sarath Palita, Professor Mahadev Joyswal, Convener Dr. Chandi Prasad Nanda, and Charudar Panigrahi for their motivation and guidance. My special mentions to Dr. Vikram Kesari Jaina, Director, Center for Adivasi Research and Development, Dr. Nupur Patnaik, Dr. Shubham Das, Dr. Sabar Bhatt for helping me to carry forward this session. And thank you all the listeners who listen us via Facebook and YouTube, and sharing and listening Dr. Jesani's ideas on specifically on medical ethics and the crisis of pandemic management and policy frames. Thank you all for being with us, and thank you, Dr. Jesani, for your wonderful lecture. We'll definitely wait for the future engagements with you. Thank you.